Hi everyone, welcome to another video. My name is Justin from Sinclair Dental, and today we have a special guest. We have Suzanne Bourque from Septodont. Good morning, Suzanne.
Good morning.
So today I was really excited to have Suzanne because she has a great new innovation that Septodont came out with the Dentapen, which was around a year and a half ago, Suzanne, approximately.
It's going to be a year in July. This July
Perfect.
coming is going to be a year.
Perfect. And it's a product that's been out in the States, I think, for a little bit for that as
Over two
well.
years. Two
Perfect. So it's,
years. And then Europe, it's maybe 3 or 4 years. So
wow.
it's
Okay.
not very new.
It's been tested and proven, and the results are there, and it's a very
Yeah.
exciting product, and it's something that's very unique in the market, especially from a very reputable brand. So I was so excited to ask Suzanne today to obviously show everybody the benefits of this great product and how it can really help out pretty much every dentist to really relieve the stress of maybe doing these great anesthetic. It's always a tricky thing to do, and it's always the most from I'm sure from every patient the most stressful part of the dental appointment, to make sure that they're not going to feel as less pain as possible throughout their appointment, right? So, and I've heard most of the time, if a patient doesn't come back at the clinic, it's because of pain. It's not because of they didn't like the other experience, is because of pain. So I find this is a great tool to implement in a day-to-day practice. Doesn't matter what your specialty is. So Suzanne, I will leave it to you to explain to us exactly what Dentapen is and how it can benefit our customers.
No problem. Thank you, Justin. And thank you for having me with you guys. Really appreciate, Justin, for you to put up all this presentation with me. So like that, all the dentists will be informed of the new stuff we have. So this is our new baby. So, and just before starting, I'm missing a lot of you guys in New Brunswick. We can't travel. You keep us out of your of your territory, but it's okay, and you're doing a good job of it because you have less case than us. So I'm missing you a lot. So we'll start with the Dentapen. Dentapen is pretty new, like Justin was saying. Do you see my presentation?
Yep,
Is
all
it
good.
okay?
Mhm.
Perfect. So the Dentapen is the C-clad. It's an electronic device control anesthetic, local anesthetic. It's very light as a device. It has 3 speed, which we will see in the other slide there. A 2 injection mode, battery operating. So this is the most best benefit of the Dentapen is it's portable. We have other device like that on the market, but it's always with wires or pedal or a console, so you can't really have it room to room. So this is one of the biggest benefit of the Dentapen. It has also one great benefit that has, it's that you could use any kind of needles and any kind of anesthetic. So it doesn't have to be our needles and neither our anesthetic. It's preferable to have Septodont, but you don't have to. And the suggesting price, it's around $4,000. So $4,000, yeah. So all the control on the Dentapen, it's all on the top of it. So you have all the button in there that it's supposed to be there and easy to use. That's mainly what I have feedback from the dentist. It's very easy to use. You don't have to change your technique. Nothing has to be done concern that. So better control, focus, you can focus on your patient more. The injection is flow, rate, delivery, and optimal speed. The injection flow rate is monitored to limit pressure. So if you're not at the right place, the device will slow down the injection. And also it has the most comfortable injection, palatal, intraligamentaire, and can be performed quickly, comfortably. So like Justin was saying, a lot of patients doesn't want to come back at the clinic because they have the fear of the pain of the anesthetic, but most of it, it's not the needle. The needles goes in the tissue it won't have as much pain, because we have all now with the time, we have all the gel that we put, the topic. The most pain that the patient has is the injection. The anesthetic is very acid, and because it's acid, it doesn't, you know, the body doesn't take, if you go too fast, the body won't take the anesthetic as good. So it will hurt the patient. So that's why having a device like that that will control the injection with different speed, it will less pain for your patient. So the manual injection induce pressure variation. So with a normal syringe, for sure, the doctor will inject the anesthetic a little bit faster. What it would be so beautiful for you dentists to do your injection at 8 o'clock in the morning or 8 o'clock at night, and it would be all the same injection. We all humans, so for sure, if you work all day long, your injection at the end of the day won't be as accurate or as less painful for the patient. You will go faster. So if you go faster, more pain for the patient. So the golden standard for the injection, it's 1 minute for 1 ml. This is the golden standard with Stanley Malamed was saying to all dentistry that we should take 1 minute for 1 ml. If you don't do that, well, the epinephrine won't do the work inside the body. So it will take longer to do your onset, so longer to preserve your obturation, and it will be more painful for your patient. So 96% of the dentists prefer electronic syringe than manual syringe. And the pain perception reduced by factor 2. So I heard that when you have the injection with the Dentapen, one of the dentists in Vancouver said that at the palate, it's no pain. And also what he was saying to us, that he has less, the anesthetic, he's using less anesthetic because he's doing his minute. So less anesthetic because he doesn't have to take 2 cartridges to do the anesthetic.
So the performance obviously is a big factor. It's not just the comfort, but it's the performance of the anesthesia is actually, you know, it has the benefit for that as well, correct?
Yeah, because, you know, sometimes dentists, they say, oh, it doesn't freeze my patient, but a lot of time it's because they don't take the time to do the injection that it's supposed to be that minute.
Right.
So they will take another cartridge to do, you know, a better freezing for the patient. So the future and benefit of the Dentapen, it's a very comfortable injection. So it's very small, it's light. So I have it with me. Here we go. It's very, very small. It's, you know, it's in your hand like that. So when you see the picture, you think it's way much bigger, and it's very light also. So because it's light and small, it prevents a lot of muscular strain from applying repeatedly force on your wrist. So the carpal tunnel, it's less, you know, you won't have as much problem in the year coming. Also, we have 2 adapters here, the syringe one and the finger grip. So you don't have to change the way to use the Dentapen. It improved the visualization, and it's better posture for the dentist because he doesn't have to lay down, you know, it's just put the syringe and that's it. For the patient, what is good for the patient, it's because it's small and modern, they have less fear of the injection. And because the flow and the mode and the speed, it has less pain, better anesthetic. Like I was saying, the Dentapen has 2 ways to the adapter. One is syringe and the other one is the pen one. So the dentist who's used with the electronic device, like the competition, the one or CaliJet or Quick Sleeper, sometimes they would prefer the pen one because it's kind of a pen, the one, so they will go more with that. So the old generation of the dentists will prefer, stay with the syringe adapter. And it has, like I was saying, any kind of needles or anesthetic, it's okay. So you don't really have to do a training for using Dentapen. So it has no cord, so minimize the pressure on the, the hand and the needles. It has no foot pedal, so more attention on the patient, and it has no console, so no more space, for your operating room that you need. That's the products. So everything that is in plastic in here, the older cartridge, the adapter, that goes in the sterilization. Mm-hmm. So at either plastic or very low sterilization. I say it because I had one dentist who did it. So this doesn't go in the sterilization, okay? It's very important because all the control is on the top in here. This is the little battery that goes at the end of it. So, and we have barriers that goes on the top of the device. So these are the button. The second one is the on and off button. So the green is for the battery's okay, you could inject, no problem. The orange, it's coming to, think about changing the batteries. The red, it needs to be changed. When it's blinking blue, it's because you are injecting. It's the activation point is on the top, and I will show it to you, the device, live, so you'll see how it works. And that's the rewind button. So if you need to do a second injection because you had two quadrants,
yeah.
Thank you. Then you would have to, unload the Dentapen and put another cartridge. So these are the speed. The fast one, 30 seconds, that mostly is going to be used for the block or Spix. The 60-second will be used, more for all other injection and filtration intraligamentaire, and the 90-second will be mostly taken for the palatal. We have two modes: the constant flow that most of the dentists use with the regular syringe. And we have the rend up. So some of the dentists will go slowly at the beginning to freeze the tissue, the soft tissue. They will go back and they going back to re-inject because the soft tissue is more frozen. It's less pain for the patient. So it does that too with the Dentapen. So we'll go very slowly, a little drop, very slowly at the beginning, and it will pick up the speed you choose, okay? The competition, the one, okay, that is on the market. It has cord in here, so you will lose a lot of anesthetic in this part here. It's very expensive. It's a good product. It's been over in the dental field for a long time, but it's a kind of a different way to use an electronic device with the Dentapen. So the end of it here, the needles, it's pretty much, it would cost you around $200 to $500 a month, and you have to buy it from the company, which we don't have to. You use your regular needles, okay? And it has a foot pedal and a console, so you need to have your patient in that room. The CaliJet is pretty much the same, okay? Looks like it's a little bit smaller. It's a good device. I did sell a Dentapen to one dentist who had the CaliJet, but he had that for maybe many, many years, like I think it was 25 years. And he wanted to have it changed because of that. It was portable and it was easier for him to bring in room to room. You have the quick sleeper, sorry. The quick sleeper is mainly for intraosseous. So our Dentapen doesn't do that. It does all the injection excepting the intraosseous. So 84% of the dentists do not take the minute to inject. And it's funny because we have a demo that I could lend it to the dentist so he can try it, for a week or two, whatever it takes the dentist to try it. And one of the dentists told me, "Oh my God, this is way too long." I said, "Well, it's a minute. It's not that long." So they think they do the minute, but it's pretty long doing a minute to do the injection. It's a better control, wide Dentapen, better control, very light, portable, moderation pressure. It also has, which I didn't tell you, the self-aspirating. So if you push the button activating and you re-push it, it will do the self-aspirating. So you will see if you're at the good place to inject. Dentapen is warranty 24 months for the device, 3 months for the cartridge. It's around $100, under $25 for a package of 10. Like this is the package of the battery. So you have 10 in there, and one battery is going to do 200 injection. Okay. You also have the barriers, so 250 barriers for around $125. Dentapen is closing automatically. So if you put on the Dentapen and you go talking to another patient, it will close up in about 4 minutes, which it would, keep the battery longer. And if you don't want to use the barrier, you can't use cavity wipes or semi-cloth because of all the control on the top. It stayed too long and it could be defecting the device. So it needs to be a bleach diluted in 1 in 100 solution in water. I know there's a lot of those wipes there called Clorox, which is a good one to take to clean up the Dentapen. So it's too expensive. Some of the dentists will say that, but it's the very new generation of the C-clad. So, and it's pretty much the cheapest one on the market. If you see the other competition, it's pretty much that price. But with the Dentapen, you have less cost after for, the needles and stuff like that you have to buy directly from the competition. It's been doing injection. I've been doing injection all my life and nobody complained. So that's good, doctor, because you're probably doing a very good job. But what's in for you? Treat yourself with the C-clad. It will help you to your injection with no force for your risk, because with the time, maybe 10, 15 injection a day, it will come that you will maybe have some problem on your risk. So that will help you. I already use topical. That's good. That means you are very, you're very aware of having the patient less pain. But it is good for the needles. But most of the pain will come from the anesthetic, which is very acid. Mm-hmm. And the more it's acid, the more it's painful for the patient. Dentapen is small, but then it looks like it's a gadget. Well, it's pretty much the new generation. It has 2 years warranty, which most of the other device of the competition has 1 year. So we're pretty much concerned about, the customer service of the device and make sure that the dentist is happy with it. That's why we do have demos, so you can try it on before you're buying. Already have a syringe. Well, if you are satisfied, good, it's good. If there is anything that you would like to change for a syringe, you can let me know. What can I help you to, have you use the Dentapen, because I think it's a very great device for you to have in your offices. I don't want to change my habit. Well, with the Dentapen, you don't have to change your habit. It has the adapter as a syringe and it's very easy and light to use. I think I have a little video. If we have time, I will show that video. So if you want me, Justin, to show, I don't know if you can see me. Oh, here we go. I'm just going to stop sharing, I guess.
Yeah.
Oh, well, if you want to see the way, do you want me to show it before stopping sharing?
Yeah, well, you can stop sharing there, so you will see your screen a little bigger there. So.
Okay, perfect.
Yeah.
Perfect.
Perfect.
Okay, so that's the battery in here. So you just unscrew the battery and it's inside. So it's not a rechargeable battery, because if we would take a rechargeable battery, it will be a little bit heavier. So that's why we did it like that, to make it very, you know, light and comfortable for the doctor. This is the cartridge for the anesthetic cartridge. So it's transparent, so you can see, you know, what's happening. That's the adapter. So you just put it in. You have two hooks in here. So you just go vis-a-vis les hooks and you just click it. So it's ready to put the needles. So you just put the needles inside. So I put the button on and off just in front of here. So on. When I put it on, maybe you won't see it, but it will show a little bit of liquid. So that means the needle it's inside properly. Okay. So now if I want to inject, I just push it here, or with my thumb in here, or my finger. You don't need to hold it. You just do it once. That's it. And when you re-push it, you have the self-aspiration. Now I'm sorry about that, but I think my cartridge is empty. So that's not good. I put a cartridge that had no anesthetic inside. So that's why you don't see anything. Let me just take a new one. Sorry about that. Do you have any question in the meantime, Justin?
I do. So, you know, you've mentioned a few times about, you know, aesthetic, that, you know, naturally the anesthetic is an aesthetic product. And I know that Septodont is you know, producing a less aesthetic product than the competition. You know, it seems to be a premium product. So my question is will the impact be more, how can I say this? Will the impact of the performance of less pain be more available for the customers that are actually using a more aesthetic anesthetic, or is it pretty much all the same? Doesn't matter what they're using?
It's a little bit different. Okay, you have three companies who makes the anesthetic, and Septodont has the anesthetic that is closer to the pH body, which is less acid. And when it's less acid, well, the onset when you do your anesthetic is faster, and it will freeze also almost perfect. It's very rare that you will have to take two cartridges to freeze down. If you go very fast, then probably you will, but if you take like it's supposed to be, you will be okay. So yes, Septodont, I think the anesthetic is a little bit more comfortable for the patient because of the pH, that it's closer to the pH body. So we have the pH in between 4.2 to 5.8. Our body pH is 7.4. So all the other manufacturers are below 4.2, which is not a bad anesthetic. It's just less comfortable for the patient. But with the Dentapen, because dentists thinks that, you know, they doing the minute, but they don't. It's a fact. Well, with the Dentapen, you don't have a choice. You have to do the 60-second, you know, for the injection. You have any question? Any more question?
No, I mean, I think everything was very, very simple. I think the last question I have is if a doctor would like to try it, what is the procedure? Do they call you directly? They can ask me. How do they do this?
They can ask you, or they can call me, whatever you feel that it's better for you. And I could ship the box of the Dentapen
Mhm.
They could, keep it for a week, and I will have somebody, a courier, take it back at the office.
Perfect.
So you need to sign just a document that, prove that I send you that Dentapen. You will have enough barrier, and you will have enough cartridge holder and adapter, so you could use it easier.
Perfect.
So just want to make sure that it's now. So you'll see now it goes very fast because it says that it's 30 seconds. Let me just put it like 90 seconds. You see,
Mhm.
it's a little bit, it's less faster.
Perfect.
So it's pretty much easy to use, it's nothing very complicated.
Okay.
Any more questions, Justin?
No, I think it's a great, very great innovation, and I think it could be a very great tool for many patients, for many doctors to, I think it's, it is for the clinic, but I think it's a great gift for the patient, especially if they're, so afraid of going to the dentist. Even, I know some, clinics throughout Canada, they're using every possible method to get more patients and make their patients happy so they can get more patients. In New Brunswick here, everybody's so busy, and usually it's never the case, right? But it's funny because I did see a video online. It was somebody in the States, and he was promising to get more patients, was promising his patients no pain anesthetic. And he was taking 15 minutes per patient just to freeze the patient, which I find it was insane. But my point is he built a great company, a great clinic, just because of the no pain. So obviously people find that it's so important that they're going to feel that way. And for me, I believe, a person that has a great treatment with no pain is going to be really more interested of accepting a further treatment than refusing it, right? So if somebody's in need of very big work in their mouth, but they're so afraid of the pain they're going to get from the needle, they probably not going to accept it, right? So I think this is going to be an extra tool to really help the patient out to make the right decision for their oral health.
It's a big success, for a dentist's office, because what is, like, if you have a new customer, a new patient coming to your office, and if he had some pain, the first thing he's going to say to her neighbor is, don't go see that dentist, he's hurting me.
Yeah.
So, I mean, I think I know a lot of dentists does a very good job in the anesthetic. They take the minute, and they are be careful, to not having the needles hurting the patient, and it's good, but it has other benefit that you could use that Dentapen for you, doctor, and make it more easier for the patient and less painful.
Perfect.
So
yeah. So like I said, thank you so much for taking the time to be
no problem
with my customers in New Brunswick. We really look forward to seeing you again in the clinic.
Yeah, me too. I miss you so much.
And I'm sure it's going to come soon in the next year, I hope. And I'm sure by then we might even have new innovations from Septodont as well. I really, truly believe the quality of Septodont products. So if there's any other questions about any other products, please don't be shy to ask Suzanne or myself. Septodont, they're leaders in their field. And, obviously we have great support from Suzanne. Even if she's far away, you can still,
I try my best.
Perfect. So
thank you for having me with you, Justin, and all your customer. I wish you to be safe and have fun for the summer coming.
Awesome. You too as well. Have a great day.
Thank you.